I'll be your student nurse today. Can you tell me your name?
Christopher Kilch.
Hi, Christopher. Can you tell me your date of birth?
3/5/90.
Okay, and we're going to do a physical assessment today. Are you okay with that?
Yes.
Good. I'm going to wash my hands. Okay, so what I'm going to do is I'm going to start from your head. I'm going to work my way down to your toes. So if you could just lean forward a little bit for me. I'm going to inspect the scalp for any types of lesions, depressions, or brittle hair. Scalp is moist. No abnormalities, depressions, or lesions. Alright, you can look back up at me. Face looks good. I'm going to check cranial nerve number 7, which is your facial nerve. So if you could just puff your cheeks out and smile for me. Good. Patient's cranial nerve number 7 is good. Face is bilateral symmetrical. So now I'm going to check cranial nerve number 5, which is the trigeminal nerve. I want to touch your face with this piece of cotton. And I want you to close your eyes and just let me know whenever you feel it by saying now, okay?
Now.
And I want to check your mandible joint. Just open, close, open, and close. Good. Patient's cranial nerve number 5 is good. Looks to be intact. So now I'm going to palpate your sinuses. I'm going to touch your face and just let me know when you feel any types of tenderness, okay? Your maxillary, and your frontal sinus. Good. So now I'm going to move on to the eyes. Eyes look bilaterally symmetrical. I want to check the conjunctiva is pink and moist, and sclera is white and moist. So now I'm going to check your perla. I want to shine this light into your eyes and just look straight at me, okay? Pupil constricts. I will check your cranial nerve number 2, which is your optic nerve, by taking you over to the Snellen chart, having you read the lowest line you could read, make sure you have 20/20 vision, and bring you back here. Now I'm going to inspect the nose. The nose, can you feel your nostrils for me, please? Okay, nose is bilaterally symmetrical, no deviated septum, and no lesions on the outside. Skin color is good. Now I want to inspect the inside of the nose, so if you could just tilt your head back a little bit. Mucous membrane is pink and moist, no inside lesions. Everything looks good. So now check your patency, so if you could just sniff and sniff. Good, no blockage. Now I'm going to move on to the mouth, so if you could just open wide for me, please. Hard palate intact, soft palate looks good. All teeth seem to be intact. Gum looks healthy. Can you stick your tongue out for me, please? No bumps or lesions on the tongue, and stick your tongue over your mouth. And mucous membrane is pink and moist. You can close your mouth now. External mouth looks good. Lips are pink and moist, no outside lesions or cracks. So now we'll move on to the ears. No outside lesions. Ears look symmetrical with the face. So now I'm going to check for any types of tenderness. I want to touch your ear and just let me know if you feel any type of tenderness, okay?
Yes.
Good. Now I want to check your cranial nerve number 8, which is your auditory nerve. So if you could just stick your finger in this ear, I want to whisper something in this ear and repeat it back to me, please.
Okay. 5729.
Good. Patient's hearing cranial nerve number 8, which is your auditory nerve, is good. So now I'm going to move on to the neck area. I'm just going to inspect. Can you swallow for me? Okay. Trachea is midline with the body. There's no enlargement of the thyroid gland, so now I'm just going to palpate for the carotid artery. Good. Good. Now I'm just going to auscultate. What I'm going to need you to do is just take a deep breath, exhale it, and hold it, okay? I'm going to listen with the bell of my stethoscope. Okay? Go ahead and take your deep breath, and let it out. Hold it. Good. I'm checking for any kinds of bruit. A bruit would indicate a narrowing of the blood vessels and a blockage in the blood flow. So I'm going to do the same thing on this side. Just take a deep breath, and exhale. Hold it. Okay. No bruise indicated. So now I'm going to take your cranial nerve number 11, which is your spinal accessory nerve. I'm going to put some pressure on your shoulders. I just kind of want you to shrug up, okay? Good. And just push towards my hand. Good. And just push towards my hand. Good. Patient's cranial nerve number 11 is good. So now I'm going to move on to the anterior thorax. So I'm just going to palpate. Make sure there's no types of lesions or masses. Good. Then just take a deep breath for me, please. And let it out. Okay, chest is bilateral symmetrical, both sides rise and fall when inhaling and exhaling. So now I'm just going to auscultate the lung field. I want to listen for a full respiratory breath. Listen, make sure there's no signs of crackles, bronchi, or wheezing. I want clear sounds. So I'm going to start at the right side, just below the supraclavicle line. Move to the left side, just below the supraclavicle line. Left second intercostal space. Right second intercostal space. Third intercostal space. Third left intercostal space. Fourth left intercostal space. Fourth right intercostal space. Fifth right intercostal space. Fifth left intercostal space. Sixth left intercostal space. And sixth right intercostal space. Lung fields are clear. Okay, do you do a monthly self-breast exam, sir?
No.
Okay. I know it might sound silly, but even guys have to do it, especially if you have a line of breast cancer that runs in your family. What you want to do is you want to pick the same day every month to do it. You can do it lying down, standing up, in the shower, kind of whichever is comfortable for you. What you want to do is you want to put your arm above your head like this, and you want to start from the armpit and work your way down. Just kind of do circular motions like this, and just make sure you feel for any types of bumps on the way down. You want to cover the whole breast, and you just kind of want to go in a circular pattern all the way across, working your way towards the nipple. When you get to the nipple, you want to squeeze it, make sure no discharge comes out, in the same way laying down. You put your arm above your head, you want to elevate your back, and you want to make it go flat by putting like a small pillow right there. Starting from the armpit, work your way down, circular motions, make sure you cover the entire breast.